to design a standard procedure used in the collection and preparation of fresh frozen plasma. The standard operating procedure aims at providing laboratory staff and others with professional and regulatory guidelines in collecting and managing fresh frozen plasma. Policy. The policy aims to provide an easily accessible and adequate supply of safe and quality blood and blood components collected, procured from a voluntary non-remunerated regular blood donor in well-equipped premises, which is free from transfusion-transmitted infections and are stored and transported under optimum conditions. Transfusion is under the supervision of trained personnel for all who need blood. Scope. After approval, this procedure applies to all trained laboratory attendants and scholars learning how to collect and process blood plasma. Specimen type. The accuracy of test results is dependent on the integrity of specimens. Please examine specimen collection and transportation supplies to be sure they do not include expired containers. Label a specimen correctly and provide all pertinent information required on the test request form. Submit a quantity of specimens sufficient to perform the test and avoid a quantity not sufficient, QNS, as indicated in the test requirements. Always draw whole blood in an amount 2½ times the volume of serum required for a particular test. For example, if 2 ml serums are required, draw at least 5 ml of whole blood. If there is difficulty in performing venipuncture, the minimum volume may be submitted if it is indicated in the test description. For most profile testing, draw at least 2 8.5 ml gel barrier tubes. Carefully tighten specimen container lids to avoid leakage and/or potential contamination of specimens. Specimen accountability requirements and rejection criteria. Proper identification of specimens is extremely important. All primary specimen containers must be labeled with at least 2 identifiers at the time of collection. Presented slides may be labeled with a single identifier, but 2 identifiers are recommended. Identification includes the patient's name as they appear on the test request form, date of birth, hospital number, test request form number, accession number, or unique random number. All specimens should be labeled in the presence of the patient. Process and store the specimens as mandated. Whole blood can be stored at 4 to 8 degrees Celsius for up to 24 hours before the serum is separated, but it must not be frozen, whereas serum should be stored at 4 to 8 degrees Celsius until shipment takes place or for maximum 7 days. Required reagents and material supplies. There are several reagents and materials used in preparation. Some of the materials needed are gloves, alcohol or iodine to cleanse the area, lab coat, reagents, a tourniquet, tubes, a tube holder, needles, tape, and gauze. The red top tube contains no anticoagulant or preservative, mottled red, gray top, gold top, or cherry red top, gel barrier, tube clot activator and gel for separating serum from cells, but not an anticoagulant. The lavender top tube has K2 EDTA while the tan top tube contains sodium EDTA for blood leads analysis. Calibration and precision verification procedures. Precision evaluation is incorporated into the calibration process and must be completed with successful results before performing calibration. Following completion of the calibration process, evaluate quality control. Verify acceptable results. If post-calibration quality control is not acceptable, perform troubleshooting and repeat calibration if necessary. Quality control procedures. Daily quality control by measuring and recording the results from the use of hemotrol at the low, conducive, and high range for the device will be done. It will be performed as the day commences a day before blood collection and at the end of the day after blood collection is done. Procedure. The considerations in the preparation of plasma involve collecting specimens in additive indicated in the test requirements. Mix specimen with additive immediately after collection by inverting 5 to 10 times. Avoid hemolytic or red blood cell breakdown. Fill the tube, thereby avoiding a dilution factor excessive for total specimen volume, QNS. Separate plasma from cells within 2 hours of venipuncture when indicated in the test requirements. Label transport tubes as plasma. Indicate the type of anticoagulant, for example, EDTA, citrate, etc. Limitations. Label each aliquot tube properly for easy patient identification during processing. Avoid putting unspun tubes in the refrigerator, since it increases. You can find this and many other assay samples on our website studycorgi.com.